My name is F. Perry Wilson. I'm an associate professor of medicine here at Yale. I'm a nephrologist, which is a kidney doctor, but I spend most of my time doing clinical research into kidney disease and using some of the techniques of data science and machine learning to try to improve how we care for patients. Pouring through the medical literature, I've always been fascinated with how the public interprets medical studies. I started writing commentaries for a medical website called Medscape a few years ago, where I would look at a medical study and just ask, what does the data actually say, and compare that to how the data is being interpreted. And it allowed me to improve my own research, the standards of my own research, but also to really get a sense of what's going on in the country as social media picks up these medical studies and explodes them and transforms them. And oftentimes, by the time it shows up in your social media feed, it's completely different than what was written in the medical paper itself. So I've always been fascinated by that process. And now in collaboration with Yale and Coursera, we've distilled all that knowledge into an online course that allows really anyone to understand a medical study. That was the goal from the beginning, to be able to read the actual study, not the news report of the study or your friend's take on the study or what you see on Twitter, but the actual study, and make your own decisions about it. So the course is on Coursera. It's called Understanding Medical Research, Your Facebook Friend is Wrong. Basically, we wanted to grab people who are getting frustrated with how they're getting their information on medical studies from kind of all sides. And so many people I've talked to have told me that they don't know what to believe anymore. They can see the same study that's referenced and linked in one of their friends' Facebook feeds that says, this is the best thing ever, and another friend who says this is the worst thing ever, and no one exactly knows what to do with it. And it enters this sort of cacophony of social media. We want people to have the tools to figure it out for themselves and to go to that data and to be really informed about it, because that's the best way to take care of your own health and the best way to take care of your loved one's health. Now, is your Facebook friend always wrong? No, your Facebook friend is not always wrong, but you need to figure that out for yourself. You just need the tools. We've entered a crisis worldwide in the setting of the coronavirus pandemic, and it is a public health crisis. It is a crisis on an individual level for many people who are out of work or who are sick themselves or have loved ones who are sick. It is also a crisis in the medical literature. We are desperate for information about coronavirus, and researchers across the world are pulling data together as fast as they can and putting it out there as fast as they can. And a lot of the checks and balances in research studies have been removed in this setting because the data is so vital. Now, that's okay. I don't think it's wrong that peer review has gotten a little bit lax in the setting of the coronavirus, but it's really important that people understand, especially when you've got a fire hose of data coming at you, which data is reliable and which isn't. So really now more than ever, the ability to carefully read a medical study is so important, because they're coming so fast and furious that there are a lot of good ones, but some bad ones are certainly slipping through the cracks. You have to take the word of the people who wrote the paper that they did what they said they did. Now, the vast majority of scientists are ethical people that are really trying to advance health and welfare and medicine in general. So there are, of course, some notable cases where there have been outright frauds, studies that are reported that didn't happen, but those are exceedingly, exceedingly rare. The issue really arises in interpretation of data. Usually, the vast majority of the times, the data is reported accurately. The interpretation of the data, the spin of the data, what does this data mean? Well, that's filtered through a whole lot of biases. It can be unconscious bias too. Researchers have beliefs. They think that a certain drug will work, or they think that a certain chemical is really important. And when they see the data, they find a way to comport that data with their beliefs. And that's human. That's totally understandable. What we have to do as readers is to ask that key question, which is, what else could explain this data? What's another possibility? And a big part of the course is teaching people how to look at the data, and before you look at the interpretation that the authors give to it, you try to figure out for yourself what's going on. And you are often surprised that your interpretation and the author's interpretation may be quite a bit different. And that's all right. Science works this way, and we take slow steps forward. So, are people affected by, do corporations fund studies? Yeah, they do. And there probably is bias there that the interpretation of the results of that study are going to look more favorable to the corporation. Maybe not through nefarious purposes, but just through the very human idea that the people that are conducting those studies want them to work. So we really do have to look at the data for ourselves and ask the tough questions. Does this really work? Is this data supportive of that hypothesis that started the whole study? This is one of the other major crises in the coronavirus era, is a crisis of motivated reasoning. This is one of the most common biases in medical studies, and whether you're conducting them or reading them, which is that you have a belief that is truly and deeply held, and you interpret data in the light of that belief. You tend to embrace data that supports that belief. You tend to reject data that doesn't support that belief. And we see people often rejecting data, not necessarily even based on scientific grounds. It's like rejecting the data not on the basis of, oh, you didn't do the statistics properly, but like this was outright made up. It is very hard to argue with someone who rejects the data itself. That is almost, for lack of a better term, that is the trump card. If someone is willing to accept that the data presented is accurate, then you can have a discussion about interpretation of the data. And as I mentioned, there are often several interpretations, and you can have reasonable, rational arguments about that. If you throw out the trump card that says, I reject this data is fake, this data isn't real, this scientist, made it up, there's really no argument. And of course, that is the death of scientific discourse. There were more than 1.3 million medical articles published last year alone. No one is reading all of them. So we really, the first step to learning how to interpret a medical article, find something that catches your interest. Most quality reporting outlets, national and reliable local sources, that are publishing about medical studies will have links back to the original medical study. So if you read an article in the New York Times, or if you see something on Fox News that talks about a study, find the link, go back to that original study and see what was actually done. That's the first step in just sort of flexing that muscle in your brain about interpretation. But there are certainly things outside of the current pandemic that always gain a lot of traction, and I think often unnecessarily so. There are things that have broad appeal that affect people in their everyday lives. Those tend to be studies like diet studies. We see a lot, that eggs are bad for your heart, or eggs are good for your heart, or coffee causes cancer, or coffee cures cancer, or chocolate can be used as an antidepressant. These studies have a lot of sort of clickability. They're really easy to share. The headline is relatively easy to understand. But as I discussed in my course, actually, we spend a whole lecture on these dietary studies. Many of them suffer from a pretty major flaw, which is that they tend to ask people hundreds of questions about their diet, but are only reporting the things that seem interesting, which of course can increase the risk that you're just finding, by random chance, things that look like they're important when actually they aren't. Well, it is usually the sort of ecosystem here usually goes from medical journal or press release to some form of media, and then from media to social media. And most Americans are getting their news from social media, so we're already a few steps removed here. It is completely natural for the media to want to report on these high interest studies, that suggest that chocolate really is an aphrodisiac or something like that. That has some entertainment value, really, and so that's fine. I understand how the news cycle works. my goal is not to chastise reporters and say, oh, don't report on any individual study, wait until there's a definitive clinical trial. That's unreasonable. What we need to do is to give the people that are receiving that information the tools they need to interpret it critically themselves. I think most people raise their eyebrows when they see those studies about chocolate and eggs. We're sort of exposed to it enough now that we get a sense that, I'm not changing my life about this one thing I saw on the news. But sometimes these things can get out into social media and cause real, a domino effect of behavior change. And I think perhaps, the story of hydroxychloroquine in the coronavirus pandemic is the most dramatic example of that I've ever seen. The feedback has been tremendous. It's been super gratifying for me. We have about 24,000 people enrolled so far. The course has been up for just under a month. I'm not telling people not to use social media. I love social media. I'm on it all the time. When someone tweets something, if you're about to retweet it because you like the sound of it, take a second, look at the study, see if they're right.